Hi, Dr. Tracy Doll with Social, coming to you from the height of the pollen counts. Here in the Pacific Northwest, we are definitely experiencing those tree and grass pollens. And let me talk to you about how you can help your patients to feel better who are experiencing those ocular allergies. For mild allergies, it's great to flush the eyes out with an artificial tear. And there is a new one in the market this year that contains an ingredient called Ectoin, E-C-T-O-I-N. It comes in a preservative-free formulation. So this ingredient that's in this artificial tear actually helps to prevent inflammation of the ocular surface secondary to allergies. This is a great option for patients who like artificial tears, wear contact lenses, or have mild symptoms. After that, we're gonna wanna bump it up, and it's a great idea to move to either an antihistamine like alcaftidine or a mast cell stabilizer like ketotifen or olopatadine. Mast cell stabilizers can be particularly helpful if you're working with patients that you already know come in every year with eye allergies. Taking a mast cell stabilizer the month before patients think they need them helps to prevent the allergy symptoms to begin with. If the mast cell stabilizers and histamines aren't enough, then we have to go looking into topical steroids to combat that immune response. And loteprednol is a great option that is also FDA approved. Another steroid that can be helpful is actually not one that goes in the eye, but an intranasal spray, because we know that the nasolacrimal system works together and all that's interconnected. Using fluticasone nasal spray could actually make its way to the eye and help a little bit with the ocular allergies. Now, if I've got patients that don't respond to any of that, it's time to go to the allergist to look into immune therapy, either sublingually or injectable wise. Now, there are a couple of things we want to be careful about with our patients during allergy season. The first one with our dry patients is we want to make sure that the oral medications that they're taking for the rhinitis and is not causing them secondary dryness to the eyes. In this case, if they're experiencing that, it might actually be better for them to stick with a nasal spray and an eye drop versus the oral versions. And then vasoconstrictors. Also have to be very careful with vasoconstrictors because the arteries in the eye do not like to be clamped down for long periods of time. So vasoconstrictors like nafazoline should be used only once in a while, but not on a daily basis, because your patients could end up with a rebound redness that they did not want, because arteries do not like to be clamped down for long periods of time. With the advent of really good mast cell stabilizers and histamines in the marketplace, those vasoconstrictors aren't as necessary as they might used to be when we didn't have as many options. Cold compresses are also really good friends if you're looking for a vasoconstricting effect, because cold causes vasoconstriction. And my favorite trick is putting a couple spoons in the freezer, putting a Kleenex on, and then flipping them backwards. That really helps to recover fast from the inflammation from allergies. So hopefully you found this a little bit helpful. We've got a lot of great options out there in the marketplace, whether it be artificial tears with Ectoin, steroids, antihistamines, or taking a look out of the box at maybe a nasal spray. This is Dr. Tracy Doll for Social. Bye.